Never fun going to the dentist. I mean, I'm not going to say minimize and say, oh, there's nothing to it. Nah, there's always something to it. There's always a little bit of fear. In this video today, I'm going to take you to the dentist. I have a dentist appointment. I want to get a tooth checked. This one right here. It kind of hurts if I bite on it or bend down. So I try to take really good care of my teeth. Smiley there. I don't have perfect teeth. I like the way my teeth look, but they take a lot of maintenance and care. And I mean, I haven't had great luck since as a kid with my teeth. I really had to see that there. You can smile still. For my age, come on, man, give me a break. I'm 62 years old. Cut me some slack here. Okay? I'll see if I can get some footage from the dentist's office. A lot of times I go in these places like, if you remember, it's in the cancer clinic. I did the video there. They come and slap my hand after and said, "You no more filming in here, taking pictures. No more cameras allowed." I don't know. Some places people are picky, they don't want to help, but I mean, I want to help people, that's the idea, and help people with nephrostomy tubes. As you can see, I'm all ready to go to the dentist here. I'm just kind of waiting here, get ready to go. Loose pants, see? I'm wearing loose pants. Underneath, of course. Oh, I'm going to show you. Side kidney bag. Which if you can see that, I can't see. That's how it's all hooked up on me. Right there, the sides. Wearing loose pants, which need to be. I'll show you here. Here's the sneaky thing I was telling you about. To my pocket. There. Now if I want to empty it, see how easy it is to empty? Right there. There's my bag. If you can see that. You just put it back. Oops, down. Whoops, and we put it back in my pocket. Like this is the secret here. Bag there. Goes in the pocket. You see? Hole in the pocket. Ta-da! Goes in there like that. That's the secret. Okay, so we got the pants on. Tubes are underneath. I keep mine on the side a little bit there and there. In the front, I can let you see. I'm also blessed with this. Is coming off the front, of course. You can see I have a Foley catheter. That's where it drains into my leg. So I got the bag here on my leg. I got the two in my saw, one on this side, one on the other side. So I got the 3 bags. I'm like a gunslinger, you know. I'm a 3-bag gunslinger. Goes in there, I got the cap on, always see, so it don't leak. That's a whole difference. That's kind of for me. I haven't even made 10 videos yet, so maybe this will be the 10th. I'm not even sure. But we are getting ready. I'm getting ready to go to, of course, the dentist. Tooth there, that's what I'm getting worked on. We're going to scan it today. It's been bothering for a while to another dentist, and he doesn't do root canals anymore. It may need a root canal, I'm not sure. It sucks. But you know, I was going to go into that. I used to be terrified to go to the dentist when I was younger, scared of needles, and I mean, they hurt. They all hurt. The needles all hurt. Stuff all hurts. It sounds crazy. Once I had a root canal, this tooth there in the front, without freezing. No joking. It was one of the most painful things I've ever felt in my life. You had to take the roots off, and I didn't have freezing. It wouldn't freeze because it was infected so bad. And we had tried for about 3 months to get rid of the infection. My dentist just couldn't get rid of it. I wanted to keep the tooth. I didn't want to, at that time lose the tooth. So he removed the nerves without any freezing. And I'll tell you, never again. I wouldn't do that again. No, I'd lose the tooth first and get an implant or something. There's no way I'd go through that again. It was extreme pain, very, very hurtful. No, never again. But anyways, I go to the dentist now. It's not such a problem anymore. I'll get a needle, no problem at all. I mean, you know what? Because if you're like me and you're going to be chronic, I'm a chronic with these nephrostomy tubes. I got them for life, apparently, according to my doctor, and probably the front bag too. Believe me, I've asked all the doctors, my urologist, a number of times we went over it. I'd like to get them removed. The left kidney is not producing much, but I guess it's still producing a little bit, so they want the left tube in still. And of course, I need the one in my Foley catheter in the front, for the simple reason, I guess, it's overflow if the other one's back up. Because if not, kidneys flood again. My last good kidney was, well, good for me, 25% left. I don't want to end up on dialysis. So they explained it to me. That's what I need. I have to do. I have to have the 3 bags. So hopefully you don't have 3. If you just have 1, you're getting away with a nephrostomy tube. Wonderful. You don't want to have 3. 3's more work. There's more to remember. You know what's bad for me? What I had a real problem with was doorknobs. Just like this. In my old place, the knobs are a little lower. This one, they're a little higher. They don't catch as easy, but they'll still catch. I still caught them, especially in the washroom, on the shelves, the drawers. When your pants are off, like when I'm going to go shower, I have to be super careful. Or even when I'm in my undershorts, because they're just, I pin mine. And you may do differently. There's all kinds of different stuff you can get. You can use like underwear with pouches to do it. I have some. I haven't actually tried them yet. I ordered some offline. Also, what's the else you can do? You can strap them to your leg. I think a lot of people strap them to their leg, I'm told. I don't do that. I pin. I'm comfortable with pinning mine on my leg. So I just take 1 bobby pin on each leg. It's real simple, and pin them on my undershorts, and they stay quite comfortable. It gives a little flexibility, I find. Another thing I don't do, which you might do, I don't have the 3-way, I have to remember the word of it. It's a little square thing that fits on the end of the tube, in the middle of the tubes here. They can use to flush it. Darn it, I'll remember the name. I'll look it up for you. One of these days, we'll do a thing on, I don't use it. I had mine taken off. I asked my nurse to take it off, and she took it off, oh God, about 4 years ago, and I don't want them because I just get my tubes flushed once a week anyway, and I have them flushed with my urologist, and my nephrologist, actually, my nephrologist. What a Superman he is, beautiful, I love him. It's okay. I don't have it on there. It's okay. And I'm allowed to get flushed only once a week when they do my dressing changes. And that's how often I get my dressings changed in my back. Once a week. I'm very fortunate here. I get my health nurse come once a week, and she does my dressings for me, redoes them. It takes about 30 to 45 minutes normally. I do one side, then I have to do the other side, because they've got to do 2 sides. And every week I get them done. I have to get them done regardless. They don't usually want them to go over a week. That's about maximum, because we don't have infection. Believe me, I've got a video coming up here in the future. When you see, because I got a picture of it, I end up in the hospital for almost a week with an infection in my kidney drain. And when you see it, when you see that infection, what I'm going to show you, you are going to be more careful with your drains. I mean, I could have died at that time with sepsis. So it was absolutely terrible. And I ended up on IVs. They had to pump IVs into me, medication, stuff like that. We're going to do a video on that just to show you and to explain to you what happened. It wasn't really my fault. I didn't do anything wrong. It wasn't me, but it happened. Things happen with these things. There's so much can happen. You got to remember, they're just like hand grenades, these things. Each drain you have, each bag you have, they can hook on things, pull out. They come off, make your pants soaking wet with urine when you're out. There's all kinds of stuff they can do. Your life now becomes living your life around the drains. You know, I have stage 4 cancer. You know that, prostate cancer. And blah, blah, blah. They give me so much to live. I don't find it that painful. I get a bit of pain in my thighs right now, my thighs, and that's why they're giving me chemo again. I'm on chemo right now as we speak, actually, folks. So this is going to be a video where I'm going to the dentist. I got 3 bags. I got 2 nephrostomy tubes, a Foley catheter, and I'm on chemotherapy. I'm in the middle of sessions right now. Last week I had a chemo session. So I'm on chemo as well. Also, I always forget to tell you, but I did have a stroke in my right eye, and I'll go into that. It was to do with my catheter, believe it or not, of all things. I had a stroke, so my right eye, my good eye, is always blurry now. Believe it or not, it's always blurry. And I could have got it fixed, but I chose not to, and I will go into that one day. We're going to go into that, exactly why I didn't get it fixed. I still could probably go and get it fixed to this day where it's not blurry. So I own both eyes. It's good. It's fine. It seems fine, pretty clear to me. But if just the right eye, then I got blurriness, especially in the middle. If I go to read something, the letters look like when they're trying to prove you're not a bot. Those squiggly letters. That's what my right eye looks like when I look at letters. Like when I go get tested or something like that. It was 20/50 vision, I believe the eye doctor told me. So it's been a journey. It's been a journey. But anyways, I'm packing all this with me to the dentist. All the other things I've had too, the Graves' disease and neuropathy in my legs. I thought it was neuropathy. Now I think I know what it was. It wasn't neuropathy in my legs. It was probably that I had the cancer in my legs, and I didn't realize that at the time. Just dealing with it, going with it, and not struggling. Like I say, every time I get down, people say, "Oh, we never know you even have cancer, man. You look so good." I get that all the time. I don't know if they're telling. I don't believe they're blowing sunshine at my ass. I think they're telling me the truth. I mean, I don't look like I have cancer. They say I'm not some skinny, wilted raisin or something like that guy. I guess I look okay, and there people always say I haven't seen for a long time. Wow, I heard you had cancer. I thought you were going to be so sick. You look like you're dying. We never even know you had it. No, but I just live my life like I don't have it, and I keep my bags covered and stuff like anybody would. I'll show people who want to see. Go ahead, here. This is what it's like. You know, enjoy your life, because you know what? I told a guy today, a good old friend of mine, called me. We were talking. He's contemplating what to do in his life and retire. I said, you know what? Enjoy your life, bro. Enjoy your life, buddy. Not to know I know what I'm doing, but you don't know what's coming around the next corner. You have no idea. I got right hooked with this. My life totally changed basically overnight when I woke up in the morning in the hospital. The doctor told me that I had cancer, and ever since then, it's been kind of a slippery slope. It slipped down a long way. You know what? Now I'm maintaining. I held, and I don't know how long it's going to last for. I just, whenever I get bummed out, really bummed out, I just kind of pick up my imaginary sword, man, and I start fighting. I become a knight or a fighter or whatever you want to call it. I'm not giving up, because I actually love my life right now. I think it's attitude. I love my life. Hey, not like you. I don't have to get up for work in the morning. You know what? I'm on a permanent holiday, so to speak. No, not really, but you know, my job now is taking care of my drains. So, taking care of my cancer, my drains, my medical appointments. That's my life. That's what it is for now. So. Anyways, we'll proceed, and I'm going to head to the dentist now, and hopefully we can get some footage from the dental office. Okay, we're heading to the dentist office today. Once again, it's raining, and it's cool, and 15 degrees here. This is middle of June now we're getting to. And as usual, I'm driving, got the tubes tucked in. Going to the dentist, yeah, it used to scare the heck out of me. You know what? I've been through quite a bit of teeth stuff now, and it doesn't really bother me so much anymore. The only thing, last time I did go, and I want to talk to you about that with my tubes, you know, the dental chairs are those hard leather chairs, and you're going to have to make yourself comfortable. A few times I did quite a few adjustments with my drains, because it's pretty firm leather on the back of those chairs. If you remember going to the dentist's office, and they're pretty hard in the back. And last time I went, my drains were hurting and sore, uncomfortable. I kind of put up with it and got through it, but it's not what I want to do. Yeah, I had to adjust, and it got a little bit better on the drains. And plus, last time I went, my drains were a little bit tender. They're not tender this week. They're actually very good. I'm in a good place in my drains. I think we talked about that the other day. I'm not feeling really any pain off the left or right drain. Everything's going good, feeling good. You know, when it's like this, it's lovely when I'm not in pain from the drains, because a lot of time you're suffering from drains in a minor way. The pain, like they say, oh, how much is the pain? I get asked that all the time by if I go to the cancer clinic, or if I go to the nephrologist, what's your pain, 1 in 10? You know, normally I would say my pain on my drains just normally is between 3 and as high as 8 on a normal day, depending on the day, especially once they get bruised. Like I say, once they bruise the kidney inside, you're getting the drains dressed by the person dressing the drains. That's why lately I had a nurse change. My regular nurse comes and changes my drains every day or every week. She's actually got to step back a bit because she's been too busy apparently, and they kind of subcontracted it out to some private firm. The lady's come twice now, and she's done a really good job. I'm happy with that. But what I was worried about, and was happening before, was when my regular health nurse would be sick or too busy to come see me. Of course, there's some spare board system there, and they would come send somebody else. And a lot of times, you know what? I'm sorry, but it was a nightmare, and they don't know what to do, because I got 2 drains. That screws a lot of them up. They're not used to doing the 2 drains, nephrostomy tube. I call them drains. Listen, nephrostomy tubes, neph tubes. I'm a nephy. If you're a woman, you're a nepher. That's what I'll call you from now on. You're a nepher. Man's a nephy. How's that? That sounds good. But yeah, it depends. And what it is a couple times I've had a couple nurses come do it. Not obviously they've been doing the best they could with what they thought, but it's the way they place the drains and the locking mechanism on my back that sticks on my back, because I got full harness thing that holds the drain in place. I've seen on other videos where people just have them kind of loosen a bandage over top. I don't have that. I have a full I guess they call it. It goes to my back. It's like a little harness thing, and the drain comes out of the harness, comes through it, and sticks on it. And it's for safety, so I don't pull out the drain, is what it is. I've had lots of problems with my drains, remember, popping on me. I've been to emergency a few times. And there are 3 different ways, don't forget, you can get your drains. 2 or 3 different ways. And right now, mine just went back to the normal, loose, kind of floating, whatever. It seals itself up after about a week, heals over that way. But also you can get stitches, which I've had the stitches. It didn't seem to make much difference, because when you catch them on a doorknob or something, they're coming out whether you're stitched or not stitched. They're going to dislodge from the kidney. And ouch. The nurses I had who came a couple times, they both were male too, which is kind of weird, but they did the procedure on me, changed the dressing, and with how I did, I think they did the put it through the device that it goes through to stay in place, the harness thing. There's a name for it. It's not stat lock. It's drain fix. It's called the drain fix. When the drain fix, the way they fed it through, I believe, is tugging a bit on the kidney. What happens is it pulls a bit on your kidney. And oh my God, once it bruises that kidney inside is what happens. If I believe it gets bruised, it hurts. It starts hurting, get worse and worse and worse and worse. And of course, you're tegadermed over the top, which is a big bandage. I can show you one of those that go over the top of my to protect it from water and moisture and stuff. I've tegaderm goes over the top bits of bandage, type of clear bandage, about 12 inches by 10 inches or something like that. So anyways, when they got there and they put that on there, and it kind of tugs. I've had that happen lots of times now. And once that kidney gets bruised from that alone, my kidney is normally sore it takes sometimes a month to heal, month and a half to heal. And every day it's going to hurt. It's going to hurt. Just even a little movement or pressure on your back, it's going to hurt that drain. So if your drains are hurting, chances are that's what happened. There's something tugging on your drain just a little bit, maybe sideways or whatever way, and it's moving slightly inside your kidney. Now, it's not something I know a doctor will tell you about. I've been through with the doctor, and you know what? When I got my drains changed about a year ago, I remember going through. It was very sore at the time, and I talked to the radiologist. He showed me a picture, and what it was is my drains are kind of inflamed inside, and it was from them moving inside my kidney, because I guess, whatever, it had dislodged and moved a little bit. It irritated the kidney. So the kidney is irritated, just like having a scab, I guess, or something like that, inside your body, in your kidney. And of course, it's all sore and hurts then because it's a fresh wound, don't forget, in there. So if it's moving at all, which it is, which got pulled, it's pulling and tugging a little bit on that and forcing it to move, then it's going to be painful. And then until that heals up, man, you're going to suffer a lot of pain, because I know I did every time that's happened. And it's happened probably about, the 35 times I've had them changed, at least. No more than that. I mean, I've had them changed every week. 4 times a month at least, 50 times a year. 50 times a year I've had my drains changed. So add that times, 4 or 5 years. Yeah. Quite a few changes, maybe 300 times, and I've had probably 10 or 15 of those changes ended up hurting me really bad after. Luckily, my wife is very good at the stuff. She's been kind of mildly trained. The nurses showed her a lot of stuff, and she takes an interest in this, so she's able to put on bandages, adjust the drains a little bit from the outside and stuff like that. But a lot of times she'll have to correct it after the health nurse leaves, who's done the actual bandage changing, because I can't take the pain. I'm in total pain. She'll say, okay, let's go. We have to redo the tegaderms, redo the things that stick on the side to protect it, the little harness things. There's a bunch of things we have to redo. And there's nothing you can do. You just, hopefully it doesn't bruise too bad inside the kidney. because that's what gets you. That's what definitely gets you, is what is bruised inside the kidney. But that's what happens. When the kidney gets irritated, it's going to stay irritated. Usually, hopefully, it goes away quick and heals up. But if it doesn't, you know, you're going to suffer. You're going to suffer. And you know what? It's a sharp hurting pain in there. Kidney pain is no fun. And people, I don't know if they've ever had it, but unless you had drains, you know what that feels like inside the movie. It's like when you get your neph tubes changed. It's just a different kind of pain when that radiologist is moving that drain inside your kidney and trying to, you know, hook that pigtail in or whatever he's got to do there. I mean, that's just a different kind of pain. I don't know how to describe it. It makes you want to puke, the pain. It's like makes you want to vomit, the pain. It's weird. I don't know. For me, anyway, this is my story, how I do it. Maybe someone else will tell you differently, but you got to remember, not too many doctors that I know of had neph tubes. You know, not too many at all. Very few. There we are. We look for visitor parking. Visitor, never mind that. I got disabled parking. I'm very fortunate. Thank God I got the disabled parking. I can pull right in front. There's lots of room here. And into the dentist's office I go. Never fun going to the dentist. I mean, I'm not going to say minimize and say, oh, there's nothing to it. Nah, there's always something to it. There's always a little bit of fear. You know, you get needles and stuff, and it's uncomfortable. You got my worst part for me is keeping my mouth open, and I get sore temples for some reason. I don't know what the hell it is, but I get sore temples when my mouth is open for a long period of time. I have to keep it stretched out for the dentist to get in there. It makes it very sore. So we are heading into the dental office now. Yeah, that's the one. Yeah. Dental chair, quite comfortable right now. Yeah. I'm playing with it.
You're learning. That's the only way to learn.
Well, you can see a tooth in there too, like that.
Oh, yeah.
Camera thing. Kind of neat.
Yeah. So I'll just have you rest your head back.
Oh.
Sure. So just open it. Yeah, right down. Okay.
All right.
Yeah. Nice and still. Thank you.
You know what it is? I get this, I'm on chemo right now.
Oh, okay.
And yeah, and I forgot to tell them that. But anyways, I got chemo last week, yeah. But I get like a lockjaw thing. It's weird. I just got it there when you put the thing.
And then you...
I can't go. It hurts bad. It's like so that's just, I just experienced it a little bit there. But no, sometimes I get it when I'm eating. Oh my God, it hurts so bad. I can't like it. Seriously, it's scary. It's kind of scary.
Yeah, you have to learn.
So I don't know if it's from since I've been getting chemo, I get it sometimes. Over here in the dental office, going well so far. X-ray. Tubes aren't hurting. I'm sitting fine in the chair. I'm trying to get a picture of my tooth, but tooth back there. See them? Going well so far. It's nice that she didn't mind I was videoing, so it works out excellent. Yeah, video while we're in here. You don't want to experience different things. Like I say, my nephrostomy tubes right now aren't hurting. My Foley catheter's not hurting so far in the chair. I feel a bit of pressure in the bottom of my lower back right now. With the chair, I might have to get them to adjust it a little bit. Depending how long I'm going to be sitting here for, whether I'm going to actually try to fix that tooth today or what's wrong with it, or whether I got to come back again, which I don't have to. I hate to have to come back. You know, multi-appointment thing, but I guess it can work better for them, so appointment thing. About a mouth thing, isn't it? Tooth there, you got to twist that I can. Bite on it hard, I can feel it. I don't know, kind of bit of hurt sometimes if I'm chewing on something, that tooth there. And the front one, the front of it, it's an implant tooth there. Is it that one? Yeah, that one. No, not that one. Got an implant tooth here. One behind the implant tooth. See that one there? That's the implant. Implants, sorry, I love them. They're great. They work wonderful. Expensive though, but the only thing is I'm lucky I have insurance for mine, so some people don't have the insurance to cover it. My front view here, I'm facing the front, I can see the gas station across the street. It seems to me that's where I might have washed my car the other day, if you remember. Of course, the smile stuff. Dentist hopefully will be in shortly to see me. And I don't have to wait too long. I'm comfortable in the chair here. Hopefully it records good. I'm trying not to talk loud, but I don't have my microphone on either. I just didn't know how well it was going to go over with me filming in the dental office, but they seem okay with it so far. So we'll go from there, see how it works. Hopefully it works out. We'll see the footage, guys, for you. Traffic out front. Traffic jam. Midday too. Yeah, come on in. Oh, the dentist here. Hi, how are you? Okay, so he shaved it down a bit for now, the tooth that's bothering me. I'm not going to get a root canal. Here's the problem. It's a bit infected, so I got a prescription for it, which is fine. I've decided that, yeah, I will pay the price and I'll put it in my Visa card because, you know what, sometimes you got to do it. I think your smile is more important. Being a top tooth and all there, I got to get it fixed. We're going to do a tooth implant, put a new tooth in there, but we can't do it now. Unfortunately, it's all been approved. I talked to my other dentist I have, my regular dentist. This guy's just kind of a new dentist. He's really good as well, but I talked to him. The problem is, I'm on chemotherapy, guys. So getting chemo, they can't do the implants. They got to take out this tooth. It'll be open infection. I'm prone to infection. I probably got to even be more careful than I've been lately with so to speak, with infection. So we can't pull a tooth right now. He gave me a prescription to help heal the infection. Hopefully that will work. So I called my other dentist, and he had already pre-approved before, because I got some stuff from him for actually the same tooth that didn't really work. Maybe it wasn't strong enough for the infection. So we're going to get that, and we're going to pull the tooth. But just for now, because since I can't get it done now, it does hurt if I do. What he did is shaved it down so it actually doesn't touch. So when I'm eating, I try to eat it. It only hurts when I chew on it. So if I don't chew, it's fine. No chewing gum for a while. Yeah, so that's the situation I'm in now. I'm gonna have to wait. My chemo is every 3 weeks. I get hit with it. I'm told I gotta do another 5. I've had 5 chemo sessions now. It's June. I'm told I got another 5 sessions, so we're trying to work it out and coordinate it, me and the lady inside there. I'm not sure what's gonna happen. Of course, the chemo may get stretched, it may get shortened. I don't know. So, plus I got the nephrostomy drains. That's why when you got drains, you got to watch this sort of thing. Luckily, I remembered that you can't just, he had given me a prescription for some medicine. I looked at it, oh God, I got it, that's right too. I just can't take any prescription anymore with my nephrostomy tubes. It's got to be approved by your family doctor or your nephrologist. Get approval first, because you know what? It could damage my kidneys further. And I forgot about that for a minute. I was going to go take the prescriptions. Oh, wait, doctor. Explained to him that I don't know if I can take this medication. And you know, that was one of the ones I couldn't take, thank God, because I called my other dentist, and he's a great guy. Luckily, he went on the phone. He was available. He talked to me, and he looked in my file and got the antibiotic, or whatever it is, the medicine, we'll call it medicine, to fix the tooth that I'm allowed to have with my kidneys. you know, my chronic kidney disease. So I've already had this medicine approved by a doctor. They said, no, I can have this medicine. So I got that dentist. We talked to this dentist. And now I have a new prescription with the other drugs that was already approved by my physician. So it should be safe for it will be safe for my kidneys. I'm already approved for it. So that it's okay to take it. That's kind of where I'm at for now. I'm going to get it all pre-approved with my healthcare Blue Cross. I'll have to pay a portion for my credit card. That's okay. I don't care. I don't want to walk around toothless with a tooth there. I don't want that. And it's hard for chewing and stuff. So I'll just bite the bullet and make payments on it and get it fixed. I get partial coverage for my work. I'm still lucky from my old work, whatever it is. I'll be okay, but I'm going to get the tooth done as soon as I can. I wish I could get it done right away. He wanted to start today and take the tooth out today. I said, whoa, I can't pull it out today, man. I'm on chemo. I told the receptionist, but I guess the word didn't get over to the dentist because he's ready to pull my tooth out today. And unfortunately, no, I can't pull it out because I guess you know, with the infection stuff, I don't want to end up in the hospital. I'm probably going to say I'm probably supposed to be more careful than I am on the infection part, you know, the way I live and the way I roll here, but it's going to be okay. I'm going to get the tooth done. I'll get it implanted and everything will be okay. I just got to wait till I'm done my chemo sessions, which probably, she's saying, no, it should be about 3 or 4 months. And who knows? They can cut off any time because if it quits working, the chemo doesn't work and they got to check my PSA and my numbers. If it quits working, then they're going to have to cut it off anyway. Then I can get my implant done right away. Why do I want to do an implant? Because I don't think I'm going to die tomorrow. I think I've got a lot of life yet, so I'm still willing to go through the pain of getting the implant, and hopefully I can show you the procedure and go through it. I've already had one before. To me personally, it's better than getting a root canal. I'd rather have the implant personally. So that is my trip to the dentist, folks, and I'm on my way home now. Always remember, most important stuff, subscribe. Please subscribe to my channel so I get monetized to pay for this bloody tooth that's coming up. The implant. I want to pay for my implant. Please monetize me. Please subscribe. Watch my videos. Tell your friends, please. Anybody who's got nephrostomy tubes, please tell. Always remember, you don't have to feel good to be happy. All good, folks. All good. Life's short. Enjoy.